Hello, everyone, and thank you for joining us today for the Delray Beach Chamber's weekly webinar. Please note that these webinars are recorded and they are uploaded to our Facebook, our YouTube, and our Chamber website underneath the webinars tab. So that means if you have to leave a little bit early or you come in a little bit late, you can always rewatch this webinar at your convenience, and you can also share it with anybody who might be interested in the information. Today, we're really excited to have Dr. Sasha Chediak and Mara Mink from Clearly Derm today. They're going to talk about some common dermatology conditions during the COVID pandemic. So whether it's maskne, which I know a lot of people have told me they're having some issues from, I myself have even suffered from that, to hand rashes from overwashing, that's something I never even considered, to even hair loss. So they have a lot of information they're going to be able to share with you today. And they also have a couple of things that they're going to raffle off, but I would like to let Mara do some introductions for Dr. Chediak and also explain what that'll be. So Mara, go ahead and take it over.
Thank you, Angel. Hi, everybody. Thank you so much for joining our virtual webinar today. My name is Mara Mink. I'm with Clearly Dermatology. I'm their Director of Patient Services and Business Development. I'm going to be introducing Dr. Sasha Chediak just shortly. She is one of our board certified dermatologists. She's been with Clearly Derm for a few years now since we opened our office in East Delray Beach, where she splits her time between East Delray, our central Boca Raton office, and even spends one day seeing patients in our Boynton Beach location. So today she's going to be giving a webinar on 5 common dermatology conditions during the COVID-19 pandemic, as Angel mentioned, and she'll delve a little further into what it is that they're frequently seeing and ways that we're treating it. So before we begin, I just wanted to, I'll share my screen with you. Just wanted to tell you a little bit about Clearly Derm Dermatology and give you a little background. So Clearly Derm was started just over a decade ago. Our first flagship location was in central Boca Raton. We're still here to this day. It's on Palmetto Park Road and Power Line. We've since grown throughout the community in Palm Beach and Broward counties to 6 locations. So as mentioned, we have locations in Boynton Beach, of course, East Delray Beach, which we'll be discussing more in depth in a minute, 2 in Boca Raton Central, as well as 1 now in West Boca and Fort Lauderdale. So as mentioned, Dr. Chediak works primarily in Delray Beach, but you can also see her in Boca or Boynton if you live or work close to either of them. So really quick background on Clearly Derm, just a few key factors that we feel set us apart from other dermatology practices in the area. First, same and next day appointments, even with a board certified dermatologist. We pride ourselves on having a high level of customer service. We always have management available should you have any questions or concerns throughout your visit. We have clean, modern, and accessible locations. We offer Mohs and vein surgery, as well as medical aesthetic treatments. We accept Medicare, HMOs, and most insurances. We do offer complimentary cosmetic consultations with any medical visit. So if you're due for your full body exam, when you come in, if you have any questions about cosmetic injectables or an age spot or a laser treatment, we're happy to consult you and quote you on that during your visit as well, free of charge. We offer extended evening and weekend hours in most of our locations, as well as telemedicine, which Dr. Chediak herself is offering as well. And our medical directors design and oversee heightened COVID safety requirements, which we are happy to practice currently to keep all of our patients and staff alike safe during the pandemic. So some comprehensive dermatology services we offer. Dermatologists address everything from your scalp to your toenails and everything in between. So our team of board certified dermatologists and dermatology nurse practitioners and PAs address anything and everything you can imagine, from acne to treating skin cancers, psoriasis and other autoimmune diseases of the skin, eczema, rosacea, skin tags, viral skin infections. We even treat veins. So anything you can think of that pertain to your skin, your nails, your scalp, even around your mouth and your eyes, our dermatologist, Dr. Chediak especially, is very well versed in expertise in all of those aspects of the skin. So another thing about Clearly Derm and Dr. Chediak, Our mission is to offer comprehensive quality dermatology care for the entire family. So we treat patients aged pediatric to geriatric. Dr. Chediak herself can see an infant to an adult and even a grandparent. And again, she performs everything from cosmetic and surgical to medical dermatology. So, some things about cosmetic dermatology that we specialize in are the injectables, fillers, and Botox. We also have medical grade laser treatments and facials. We offer peels, microneedling, dermaplaning, and more. So we invite all of you to come visit us in Delray. As mentioned, we're in East Delray Beach. Our office is beautifully renovated. It's a state-of-the-art facility designed to fit our patients' needs. We're conveniently located at the corner of Southeast 5th Ave, which most of you know as Federal Highway South, and 10th Street, which is just north of Linton. We're actually adjacent to the Surf Shack subs. So we are a standalone building with our own parking lot. It's very convenient. We're handicap accessible. You walk right in. Dr. Sasha Chediak, as mentioned, is located in this office, joined by a few other colleagues. There are a few other board certified dermatologists in the office, both male and female, one of whom is our vein surgeon and Mohs surgeon, and Daphne, who is our licensed medical esthetician, who offers those facials, peels, microneedling. So I'll tell you a little bit about Dr. Chediak before handing the floor over to her. Dr. Chediak is a Florida native. She was born and raised here in Boca Raton, where she currently resides with her family. She attended FAU for her Bachelor of Science as well as a Master of Biomedical Science, and then continued her education for her medical degree and a Master of Public Health over at Nova Southeastern. She graduated in the top 2% of her class and completed her internship year and dermatology residency at Broward Health Medical Center in Fort Lauderdale. So very local. She's come to grow within this community, and she has a very good following of patients. She is involved in several research and teaching opportunities and belongs to many professional organizations in her field. I can tell you that she truly, genuinely does enjoy every aspect of dermatology, every patient of every age, and she does have a strong passion for her specialty. I'm not just saying that as her colleague, but as one of her patients and as somebody who's been comfortable referring my own family and friends to see her. So without any further ado, I'll pass the floor over to Dr. Sasha Chediak so you can meet her and hear her presentation. Thank you.
Thank you, Mara. I need to share my screen. There we go. All right, everybody, thank you so much for joining us today, and thank you for the Delray Chamber of Commerce for hosting us. We are going to talk about a few skin, hair, and nail issues that we've noticed are more prevalent during the COVID-19 pandemic, and some things related to PPE use or washing hands, like Angel had mentioned before. So we're going to start with maskne. Maskne is just a broad term that has come to cover any kind of rashes that you already have on your skin that are exacerbated by wearing a mask, most commonly acne. So it's usually this area that's highlighted here. We'll see rashes around the mouth, nose, and cheeks most commonly. So how do we prevent this or lessen the severity? The most important thing to do is change your mask often. You want to wash it or change it at least once a day, especially if you're going to be sweating or have any makeup on underneath. You want to change it often. The best kinds of masks to wear are lightweight cotton or silk, which are easily found now online or in local stores. And it is important to try not to wear makeup underneath your mask. I know every day we like to wear makeup, but that does just cause more irritation on your skin and more clogging of your pores. Same thing with sweating. You want to make sure you wash your face after you've been sweating with your mask on as soon as you can to decrease all of the irritation that causes to your skin. I'll go over in a minute how to properly wash your mask, but it's also important to follow your daily skincare routines, which I'll review in a second. If these things don't work, it's important to see a board certified dermatologist so they can get you on a good prescription regimen. So how do you care for your mask?
It's really important to wash your mask, like I mentioned, after every use. I usually recommend things like Woolite or All Free and Clear. These are very gentle detergents that aren't very irritating, so that when they're touching your skin, it's not going to cause a rash or an irritation from an allergy from the material or from the actual detergent onto your skin. If you're going to wash your mask, make sure you wash it separately so you don't cross contaminate. So if you're putting it in the wash with your underwear and your socks, that's probably not the best idea. It's best to hand wash it, or if you're going to wash it together with other laundry, heat on high heat when you do dry it, or you can line dry it as well. Some of the most common over the counter things that we recommend are face washes with sulfur, salicylic acid, or benzoyl peroxide. Sometimes people are allergic to these things. So if you have an allergy to any of these products, obviously please do not try them. So I have some little samples here of things that we recommend. This is a sulfur soap we carry in the office and you can find online. It's very affordable, it's very gentle. So this is something that you could wash your face with every day. We also recommend commonly some of the Neutrogena products. So this is a salicylic acid wash from Neutrogena that you could buy over the counter. And this was one that has benzoyl peroxide, which is another Neutrogena stubborn acne product. Again, these are all available on Amazon or in the pharmacy. You could go to Target or CVS to get them. Just look in the acne section. It's also important to use gentle skin products. I usually recommend CeraVe, Cetaphil, Vanicream, Simple, or Neutrogena. Those are the products I feel most comfortable recommending for my patients. And I have a few of those here as well. CeraVe Hydrating Cleanser is one of my favorite cleansers. It's really gentle, it's really hydrating. It's not going to dry your skin of all its natural oils. Another one that I love of CeraVe is their PM moisturizer. This is a very gentle, lightweight, non-irritating, non-comedogenic moisturizer. So that's a great one to use as well. There's also over-the-counter Differin gel, which used to be prescription strength. The generic name is adapalene, and that's a retinoid that can be a little bit irritating to your skin. It does work to help cell turnover and to prevent some of the blockages on your skin that can lead to acne. So that's a great medication that's available over the counter as well. And as I mentioned, if those things aren't working, it is important to go see your board certified dermatologist to get you on a regimen. The next thing we're seeing very commonly is hand dermatitis. Everyone's saying to sing your ABCs and wash with hot water every time that you're going outside, touching doorknobs, anything like that. So what I always tell my patients is if your hands are soiled, obviously wash them. And then other times try to use some hand sanitizer. What happens when you use water and hand sanitizer is that these are irritants to your skin. So people think that just by using water, hot water, it's not going to irritate their skin, but water in and of itself is very drying and irritating. It removes your natural oils and waxes from your skin, and then it impairs your natural barrier. So you want to be aware of those things, and I'll talk a little bit more about that in a minute. You also want to be aware of any allergies. A lot of people do have allergies to latex, and I have seen a lot of patients who are wearing latex gloves every day around because they don't feel comfortable touching handles and touching everything throughout their lives. They're scared of the virus. So just be sure that you're not allergic to latex if you're going to be wearing gloves, or get latex-free gloves. And same thing with allergies found in some soaps, lotions, and sanitizers. So I usually tell my patients to wash their hands in warm water, not scalding hot. If you're very rashy, obviously don't use hand sanitizer because it's going to burn your hands. But once your hands are under control and they're not very rashy, you can use Purell specifically is what I recommend throughout the day. I know Purell has been hard to find because hand sanitizer's been a little bit scarce these days, but I do like Purell specifically. And then if you're going to be washing dishes or submerging your hands in water, it is important to wear gloves. The kind of soap that I like, I do usually recommend Dove Sensitive Bar Soap in general. This can be used on your face, your hands, or your body. And I also do like the CeraVe Hydrating Cleanser. Some over-the-counter recommendations for the hands. This is my absolute favorite hand cream. And again, these are all available over the counter. This is called Neutrogena Norwegian Formula Hand Cream. Again, it's available in most stores, online, but that is the best hand cream that I recommend on the market. You can also use Vaseline, La Roche-Posay Lipicar, and sometimes overnight gloves can help as well. Obviously, there's been a lot of stress over the last year, so we have seen a lot of stress-related conditions. This includes hair loss, eczema, psoriasis, rosacea, dandruff, and warts. So I'm going to go through these a little bit each one so that we can discuss what you to look for, what you can do over the counter. But again, if it's beyond that, then come and see a board-certified dermatologist. So hair loss can be quite broad. There are several different types of hair loss. One of them is called alopecia areata, which are discrete areas of hair loss. This is usually an autoimmune condition that is definitely triggered by stress. And this usually needs injections or topical steroids. So this needs to see a dermatologist. We also see telogen effluvium, which is a kind of hair shedding that's very common after stressful life events. So if you've had a lot of stress in your life, if you've actually had the virus itself, which puts stress on your body, you can see hair shedding a few months later. So I've had several patients who are finding 4 to 6 months after having the virus, they're starting to notice a lot of thinning and shedding of their hair. Another kind of hair loss we also see is androgenetic alopecia, which is genetic hair loss, or the normal male pattern, female pattern hair loss. So what do we do for these different kinds? So as I mentioned for alopecia areata, that is something that should be assessed by a dermatologist. For the other two, telogen effluvium usually will resolve on its own. So we do tell patients to give that a little bit of time and it will stop eventually. But in the meantime, we a lot of times do recommend Rogaine or minoxidil 5%. This is something that is available over the counter. It's pretty affordable and it is something that you would use every day long term or until your hair stabilizes. If you have any underlying irritation or dandruff on your scalp, I usually recommend over the counter treatments. So this is one of them that I like. It's Neutrogena T-Sal. Sal stands for salicylic acid. Another one is Neutrogena T-Gel, which I really like. Again, those are available over the counter. And I'm sure most of you have heard of them, or any Head and Shoulders, any over the counter dandruff shampoo. And then we also carry something in our office called Viviscal Pro, and you can see it here. These are pills that have multiple vitamins in them and supplements that have been studied to show increased hair growth over time. So you can see we can dispense that in our office. There's also something called Nutrafol that works great. We don't carry that in our office, but they both have been shown help with hair growth. The most important thing for this is we do not recommend biotin anymore. So most patients are taking biotin for their hair or the nails. And when I talk about nails later, same thing. We're not really recommending biotin anymore. It has been shown to alter blood levels of your thyroid hormones and some of your cardiac enzymes. And we're not really finding that it helps that much with hair growth. So we're not really recommending biotin anymore. And for my patients who have ethnic hair, a lot of times all of the heating and the trauma and the processing that they do to their hair can damage it. And really any kind of hair, the more trauma that you do to your hair, the more it's going to fall out, the more damage it's going to have. So the less trauma, the less heat, the less chemicals you put in the hair, the better it will be. So I'll briefly mention eczema and psoriasis. They are very different entities that can sometimes look similar. They have different patterns and usually different onsets and different pathogenesis. So eczema, a lot of times people have from childhood. These are both definitely triggered by stress. So we've seen a lot of patients come in either with new onset eczema or psoriasis, or their underlying eczema or psoriasis is flaring. So same thing, you have both of my patients use very, very mild, gentle products. So again, I love the Dove Sensitive Bar Soap. This has been shown to be the least irritating to your skin and has the least allergens. Washing your clothes with all free and clear. And then the other products that I recommend are CeraVe cream, body cream, not lotion. I know we live in Florida and it's a little hot and sticky and people don't like to wear cream, but cream is usually better than lotion. And Vanacream is another product that I really like. And Vanacream carries face washes, gentle shampoos and conditioners, deodorants. Their brand is great if you have a lot of allergens or sensitive skin. And if these things don't help, we usually have you come in and you will need steroids, prescription strength steroids. We also have clinical trials for both of these entities, particularly psoriasis. So those are things that we offer through our practice as well. A big thing with psoriasis is a lot of patients, not patients, but people who see patients with psoriasis think that they are contagious. This is not contagious. This is just an inflammatory response on the skin. So there's nothing to be ashamed of. There's nothing that you're going to spread to anybody. You just need to get on a good system. And psoriasis, it's important to note, has a lot of different factors that can be involved, like infections, obesity, smoking, but it's also systemic inflammation, not just on your skin. So these patients can have deforming arthritis in their joints. So they do usually need to be seen regularly to make sure that that's not starting. And we have several medications that we can use to save their joints. And it's also inflammation in the arteries, the heart, any really of your organs. So you have to be monitored closely when you have psoriasis. Rosacea is something that we see a lot of, which is very similar to acne. It's more of a redness with pustules or pimples on the skin. So you can see this background erythema or redness with pimples. So sometimes people just have redness, sometimes they have redness with pimples, and sometimes it can even cause thickening of your skin on your face, and it can involve your eyes. So what are some things that we recommend for people with rosacea? These people have very sensitive skin, so it is important to use a lot of the products I've already mentioned, and sunscreen is very important. So I have a few of my favorite sunscreens here. So this is one called Elta MD UV Clear. We carry all of their sunscreens. This is a great product. It's really gentle. It has niacinamide in it, which is really great for any of that inflammation on your skin. And then I also do like the CeraVe and the Neutrogena ones as well. You can use that sulfur soap that I had showed before, which we carry in the office as well. And then there's even something called a Vanacream Z bar that has zinc in it. That's great. That's over the counter. Sometimes it's hard to find, but you can find it online. A lot of times these patients do need prescription strength medications like antibiotics or other topical medications. And sometimes we even do lasers, which we carry in our offices as well. Another thing I love for rosacea is a brand called The Ordinary Azelaic Acid. That's easy to find too. It's $10 or less. You can get it at Ulta, Sephora, online, but that's a great product for rosacea as well. And that's here, azelaic acid. Seborrheic dermatitis is also called dandruff, and we see that a lot on the face and the scalp. So here you can see there's some scaliness and redness along the eyebrows and on the nose and cheeks. And here you can see it. This is a common area that we see it on the back of the neck. So again, I talked about the T-gel and the T-sal. So just to show those to you again, Neutrogena, sorry, I know it's going in and out of my background, but that's T-gel and T-sal. Sorry about that. Again, those are available over the counter or online, and they're easy to get. There are multiple dandruff shampoos that you can try. So you can, if you get it on your face as well, you can use the Z bar. But there are sulfur products, selenium sulfide, salicylic acid, urea, coal tar. You have multiple options. And then these last two are actually antifungals that you can sometimes find in products over the counter. So all of these are different options that you can try. A lot of times patients do need topical steroids, prescription strength. So if you find that these over-the-counter shampoos or soaps aren't working for you, then come in and we can give you something stronger. Warts, we see a ton of warts, and we've seen even more that have been more resistant to treatment lately during the pandemic. Warts are an HPV virus. They're very common, mostly in kids, but we see them in adults as well. The reason we see them more in kids is because their immune systems are still adapting and growing. So they're still being exposed to new viruses, just like a cold. So if patients do have immunosuppression of any kind, we do see warts more often in those patients as well. If you left a wart alone, probably after a year or two, it might go away. But if you notice that they're growing, they're spreading, or if it's very painful, we recommend that you treat them. So how can you treat it? Over the counter? There are salicylic acid wart pastes. Most of my patients start with those. If it's a very small wart, sometimes it will work, but most of the time they need further treatment. So in the office, we have multiple different treatment modalities that we can use. We start with cryotherapy or liquid nitrogen, which is a can that we use to spray the warts. That usually does need to be done multiple times because warts can be very stubborn, especially on the hands or on the feet, like this kind of wart, a plantar wart. These can be very stubborn to treat. We can also prescribe prescription strength topical medications that we usually compound that you can use for your warts as well. We have different injectable options that we can do. And there is an HPV vaccine available that you can get if you do have a lot of warts. These are flat warts that you can see on the face. So sometimes we do see little ones like this on the face that we usually freeze or we can use retinoids for. So next is nails. At the beginning of the pandemic, a lot of my patients who have always had manicures or pedicures noticed that they weren't going in anymore to get their nails done and they were noticing all this damage on their nails. So all of this is usually from nail polish that's damaged your nails, and this can also happen from nail polish. This is more of a lifting of the nail plate from the nail bed, and then water can get underneath here and it can get infected. So you really want to be careful with these conditions on your nails. I usually recommend nail strengtheners or a clear polish. I like Dermanail, which you can find online, Sally Hansen Hard's nails, Orally Nutrition, and you also don't want to neglect your cuticles and you want to use Aquaphor on here. So this patient looks like they might have had a lot of submersion in water. There's a lot of irritation on the fingers and the lifting. You can see a little fissure or crack here. So you don't want to neglect the rest of your skin on your hands and your cuticles. Like I mentioned, we're not really recommending biotin anymore. And you want to be careful if you notice any irritation, swelling, any pus, anything like that around the cuticle. So you want to keep your nails clean and dry, keep them straight, cut straight and short and rounded at the edges. You do not want to remove your cuticles, like I just mentioned, because that can lead to infection in your skin. Avoid biting, which I know is hard for some people if that's a habit that you do. And if you do notice any of these problems, come see us. A lot of times they get infected and need oral antibiotics. So finally, some cosmetic concerns. So obviously, just like this, people are staring at themselves on a computer screen all day long now because we have virtual offices. So I've had tons of patients coming in saying, I have this brown mark here, or I'm noticing some wrinkles in my forehead, or I'm noticing I'm making this expression a lot. What can I do for these things? So it's really important to understand the difference between a filler and a neuromodulator or a neurotoxin. I'm sorry, I thought I turned this off. So what does that mean? So Botox or Dysport are some things that you might have heard of. They are similar in that they both freeze muscles from moving. So we use them here in the frown lines. I'm sorry about that. We also use them in the forehead lines. We can use them around the eyes. Those are the areas that it's FDA approved. And those, again, are to stop those movements of your face. When we talk about a filler, that's something where we do for volume loss. So we do that more in the mid face for the nasolabial folds, the marionette lines, the lips, and we can do it to add some volume to the jaw. So those are fillers. So it's important to understand the difference when you come in for a consultation, if you're wanting more of the upper face muscle movement, or if you're wanting more filling around the lower face. The most common kinds of fillers are Restylane and Juvederm products, but we do also carry other kinds. I'm so sorry about that. I thought I turned it off. So we are also seeing a lot of pigment issues. People are noticing that they have a lot of brown spots on their face. I don't know how to turn that off. Are you seeing that? No? Okay, good. So people are seeing a lot of pigment issues on their face. Sometimes this is just from sun damage. Sometimes it's from melasma, which is something that is caused by hormones and sun damage. So we have multiple different treatment options for those. So a lot of times I do use prescription strength bleaching creams. We can combine that with different peels and lasers, again, depending on the exact problem that you're having. And we do carry several different products in the office. So I do recommend using a vitamin C product. So these are two that we carry by SkinCeuticals that are excellent. CE Ferulic and Floritin CF. We also carry a brand called Revision that has a vitamin C that's also excellent. And this helps as an antioxidant on your skin for any of that sun damage. And this is something by SkinCeuticals that's called discoloration defense. That helps a lot with some of that sun damage. And lastly, this product by Skin Better called Even. These are all products that we carry in the office that are not prescription strength, that sometimes we will combine with our prescription strength medications or medical grade peels or lasers for a lot of that pigment change. But the most important thing for any anti-aging, especially living in South Florida where we're in the sun all the time, is to use sunscreen. So again, Elta MD is one of my favorites. Revision makes one as well, so does SkinCeuticals. But you got to wear sunscreen every single day, especially living in Florida. So thank you so much for joining me today. We will have a question and answer right after this. Here's a picture of me and my main medical assistant at the beginning of the pandemic when we're all in our PPE. This was pre-COVID when we were all together celebrating someone's birthday in the office. And these are my little ones who have COVID hair.
Thank you, Dr. Chediak. I think Angel is going to open the floor for some question and answer now, everybody.
Wonderful. I didn't know if we had more photos coming up, so I was waiting. All right. So if there are any questions, please go ahead and type them down in the chat box or the Q&A down below. We will go ahead and get to ask those live to Dr. Chediak. And then as they mentioned earlier, we will be raffling off a couple of services at the end. You must be present to win. So if I pull your name out of here and you are not here, unfortunately, we got to move to the next person. So I'm going to go ahead and jump start. I do have a couple of questions. I feel like I have a lot of questions, so please bear with me. And we will alternate between mine. And I know that we have some people that are already typing down below. So the first question is, are there certain types of masks that are better than others for preventing mask acne?
Yes. So I do usually recommend cotton or silk masks. Like I said, these are pretty easy to find these days because there are so many masks around. So whether you go to a local store or online, cotton or silk, and again, just washing them and changing them out regularly.
Wonderful. And then we have a question here from Miss Karen. What strength should the vitamin C be?
So it depends on what your skin can tolerate. I usually start around 15%. Sometimes I'll go higher depending on how your skin does with it, but usually about 15%.
Wonderful. We have so we have a couple of questions here. I'm going to backtrack a little bit. How is the best way to wash your mask, and should it be done daily?
So yes, it definitely should be done daily. It depends on how you want to do it. So I think the best thing to do is to hand wash it with Woolite. That's what I do a lot with my masks, and then line dry them. So have enough masks that you can have 1 or 2 every day and then wash them that way. Or like I said, you can throw them in the dryer. That's fine. You just don't want to cross-contaminate them, and you want to dry them on high, which can sometimes damage the fabric. So just be aware of that.
Yeah, I know that I've dried mine a couple of times and they shrink to about 2 times smaller.
Exactly.
So I have another question here from Deanna. I've been using biotin for a few years now. Can you please expand on why not to use biotin anymore and what the pros and cons of the recommend products like Vesicle or Nutrafol are? And I'm excited to hear this too. I was actually Googling while you were giving your presentation.
So like I mentioned, a study came out recently that showed that biotin can alter 2 levels in your blood. One of them is your thyroid levels when you're doing blood tests, and one of them is a cardiac enzyme that is a signal of heart attack. So obviously we don't want those to be falsely elevated or lowered by taking biotin. Plus, we've found that biotin really doesn't make a huge difference in hair growth or hair quality. So for those reasons, the cons outweigh the pros, and we're not really recommending it anymore. As far as Vivasol and Nutrafol, they don't really have too many side effects. Occasionally people will get a bellyache. They can be a little bit pricey. If anything, that might be a con to using those. And we usually do recommend them for at least 3 to 6 months to start, sometimes longer. So that is something that you would be using long term.
And then for those two products, is there a huge difference between them? Should you consult before choosing one, or is it you can kind of just try one and see how the results come out?
So some people do prefer using one over the other. I think it's whatever you want to try. Different doctors' offices carry different ones. Some of them do have certain products and then that people might be allergic to, or if they have certain dietary restrictions, they might not want to use them. So just talking to your doctor about that or researching those specific ingredients.
Great. And then, so I guess this question would be for our viewers who maybe haven't been to the dermatologist in a while, or maybe it's even their first time going. What kind of steps should they follow as far as, making a phone call, walking in, like what can they expect?
Mara, do you want to answer that?
Sure, I'll elaborate a little bit on that. So as mentioned, we do have heightened COVID safety policies at the moment, many of which have made it even more convenient to come see us or to communicate with us, being that we offer appointment requests online via our website, or you can email us at info@clearlyderm.com with any questions or concerns. You can message us on Facebook or Yelp to request an appointment. And if you feel like giving us a call and you have a couple of minutes, we can figure out which location is the best for you, especially if you'd like to see Dr. Chediak. We can see, depending on which day she's in which office, which time works best for you, get you in as soon as possible. And then you can expect some contactless virtual check-in. So basically, you'll receive a text message on your smartphone. You can do it on an iPad. You'll be able to utilize your smartphone device or iPad to send us your insurance card as well as your photo ID and to complete all the new patient forms. So when you come into the office on the day of your appointment, you should not have to arrive much than just a couple of minutes early. And you have the option to wait outside or in your vehicle if there is somebody else in the waiting room. Again, of course, masks are mandatory in our offices, and we are staggering the appointments to limit the, smallest amount of people we can have at one time. And I think especially in our Delray office, we have a very big, comfortable waiting room. So you can comfortably sit and wait for a few minutes to be seen. But if it's more comfortable for you, we're happy to allow you to go into your car and we'll text you or call you when you're ready or come out and wave to you. So I think we've made things very convenient, suitable, especially for the current climate with the pandemic. And of course, as mentioned, we do offer telemedicine. So if a teledermatology appointment is more comfortable for you right now, Dr. Chediak is happy to accommodate that as well.
Wonderful, thank you. And then I want to circle back because we have another question regarding the vitamins, thanks to the power of Google. I see that Viscal has biotin in it. Is it a lower dosage, thus less risky than biotin-focused vitamins?
Yes, that's correct.
All right, wonderful. Okay, let's see. I'm so glad that you guys actually mentioned SkinCeuticals and Ulta MD. I use those products. I was having some pretty bad issues with acne that I'd never experienced before. And once I got on those products, I mean, it definitely took some time. It's not an overnight thing, but I would not give them up for anything. And I mean, I've been able to bring my skincare regimen down to really just a few items, and it's been just lovely. So speaking of some of the products that you've mentioned, I've heard that if you start using Rogaine, it's one of those things that you can't stop. But you mentioned that if you feel yourself stabilizing, it is actually something that you can stop. So can you elaborate on that a little bit more? Is that a myth, or is it true that you really can't stop?
So it depends on the cause of the hair loss. So if it's the telogen effluvium I talked about, which is more of the stress-related hair shedding, sometimes I'll have patients use it while their hair is starting to come back. And those kinds of patients usually can taper off of it or stop using it. If it's more of a genetic kind of hair loss, then patients usually do have to stay on it long term. Just like if you have a blood pressure problem or if you have diabetes, you stay on those medications long term. If you have genetic hair loss, it's the same thing.
Okay.
Rogaine helps to stop the hair from falling out. But if you stop using it, then that hair will fall out again.
Okay. And then this might sound like a silly question. It might not sound like a silly question, but I always get like nervous with things that are so close to the body, I guess. It's been proven safe because I mean, it's been around for quite a while. So is there really any side effects to it, or it's pretty safe to use long term?
So the biggest side effects we see with Rogaine are sometimes people are a little bit allergic to it. They'll have rashes from it. So sometimes we do see that. The other thing is if you put Rogaine on your face, you will grow hair on your face. So I always tell patients, don't let it drip onto your face. Don't let it get on your face on your hair when you're sleeping. Make sure it stays on your scalp, because if you get it on your face, you're going to grow hair on your face.
Oh, wow. Okay. I had no idea about that. That's crazy. Okay. Thank you for letting us all know that. And then, so I have another question for you. And guys, please, if you have any questions, type them down below. I don't know about you, but I know sometimes I get nervous going in for a consultation of any sort. So it's really quite the opportunity to have Dr. Chediak here to just answer these questions as you guys come up with them. My next question is, what is the difference between Botox or Diasport and fillers? Would you recommend doing them both together, even if I've never had injectables before, to counter signs of aging? And I am actually going to follow up to that. What is the age that you would recommend that, or that you commonly see people starting to use those products?
So it really depends on your skin type and your genetics. So some people start wrinkling much younger than others. So I have a lot of patients in their 20s who do start doing it, but I'd say more often it's later 30s and 40s that patients start to do it. And I do it in men and women. So I do have a lot of males who come in with mostly for the Botox or the Dysport. And if you notice that you're starting to have lines that stay when you're not making a face, so if you lift your eyebrows and you have a line and then you relax and it's gone, that kind of line, you don't really need it yet. If you're noticing you have lines that are more permanent, that's kind of when you want to start doing the Botox and the Dysport. Like I said, they're both about the same product. They work very similarly. They both take about 2 weeks to kick in and they last 3 to 4 months. So it's something that you would have to repeat every few months, depending on how your body metabolizes it. So that is one thing. You can do filler and Botox simultaneously, depending on what your needs are. So I have a lot of patients who come in and we do all of it at once, and you can do it on the same day. There's no reason that you can't. And then, like I mentioned, the filler is more for volume loss. So kind of in your sometimes even 30s into 40s and 50s, you'll notice that you'll start having some volume loss in the cheeks mostly. People will notice lines forming around their mouth. Sometimes people just want a little bit fullness to their lips. So all of those things are what we would use filler for. Filler is a more in-depth procedure. It has more risks and complications. You will have more bruising and swelling for about a week or two. And those products usually will last 9 months to a year, if not longer.
Okay. And then forgive me if I,
Angel, I will piggyback off of that and just quickly tell everybody, we do have some great incentives right now with the rewards program through some of these manufacturers. So if you do end up having a consultation with Dr. Chediak, she'll and our staff will be able to give you a better idea, but depending on what she recommends, you can save hundreds of dollars right now on our cosmetic injectables. I think for somebody who needs 2 or more syringes of filler and then a treatment of Dysport, which is, as she's saying, similar to Botox, you could save over $500 on your treatment.
wow, that's great. And forgive me if I'm mixing this up, but earlier did you mention that some people could have allergies to this, or no?
To Botox and fillers, not usually, no.
Oh, okay, okay. I was like, I must have mixed that up. I got scared. I was like, what happens if you do a bunch all at once and then they're allergic? So that was my question, but you just
No,
answered it.
so we usually, the really only restrictions are we don't do it when you're pregnant or breastfeeding, or if you have any neurological conditions. So if you have multiple sclerosis or any other kind of neurological disease, we usually don't do it in those kinds of patients. And we're cautious with patients with autoimmune diseases. So those are really the only restrictions, or any infections on your skin.
And most of the fillers we use are hyaluronic acid based. So if you do come in and have a filler placed maybe in your cheeks or your lips, and you think maybe it's too much, or you wanted it a little less or a little different, it's always something that we can reverse with a substance called hyaluronidase. So it is something that Dr. Chediak could always fix. As she will explain to you, filler is an art, Botox is an art. So she'll figure out the perfect symmetry and make sure that you're happy with how it looks.
Oh, wow, that's really great to know. I would have never thought that that was even possible to do. Okay, so I guess my last question would be, With all of the increased hand washings, what types of soaps should I be using or avoiding in order to prevent drying out my skin? I know that I am just like constantly having to apply lotion because I just, the dryness drives me crazy.
Right. So a lot of people end up using very abrasive, harsh, like dish soap or sometimes ivory soap. All of those are very drying and irritating to your skin. So, like I mentioned, my two favorite kinds of soap, you can use this on your hands, the CeraVe Hydrating Cleanser. And then I love the Dove. So Dove Sensitive Skin Bar Soap, just put it next to your sink. Some people like liquid soap, but those are the ones I tend to gravitate towards because they're less irritating. And like you mentioned, you need to put lotion on multiple times a day. So again, like I mentioned, I'm not a huge fan of lotion most of the time. So this Neutrogena Norwegian formula hand cream is more of an ointment. So it a little bit goes a long way. You don't need a ton of it, but using that multiple times a day will help with any kind of irritation that you have on your skin.
Great, wonderful, thank you. So if anybody has any last minute questions, please type them down below. I'm going to turn it over to Mara to discuss about the services that they'll be raffling off today. There are two of them, and I just kind of want you to talk about what the difference is between them, and then we will go ahead and pull them from here. Remember, guys, if you are not present, you cannot win. I do apologize. So we will definitely make sure to double check that.
Thanks, Angel. So if you've stayed with us and you've made it this far, then you're eligible to potentially win a prize now. So we do have two things that we're giving away. One is a free area of Dysport. So it is an injectable treatment, just as Dr. Chediak was discussing, a facial relaxer for in between the eyebrows, forehead area. So she will be doing that service for you if you win. And the second prize we're giving away is a DermaSweep treatment, which is also done in our Delray office. It's with Daphne, who I mentioned earlier, our licensed medical esthetician. So you would come in and see Daphne, and it's basically a deep cleansing facial, but it's they use a machine called a DermaSweep, which is sort of like a pen that delivers suction, moisture, hydration to the skin, and it's also it's dermabrasion. So it's a DermaSweep dermabrasion treatment with your facial. It's, I think, a $110 treatment, a service. So it's a very nice treatment, a very nice value.
Is that the one that you can see everything that comes out of your skin
So
afterward?
we too, that's the hydrofacial. So the hydrofacial is collected in a basin, and you can see different impurities in your skin that it draws out. The DermaSweep is doing something similar, but it's more of a dermabrasion treatment on your skin. But it really is great. Your skin feels amazing after, and it looks very dewy and glowy, and it's a nice treatment. Very similar to hydrofacial, I would say.
Wonderful. And then before we go ahead and give these away, just so people know, after you get these, you should, or is there anything that you should do, like avoiding the sun, making sure you're not putting anything on your face afterwards for hours and hours?
Yeah, so that will all be discussed in the office. Of course, after the cosmetic injectable, Dr. Cheriak will discuss what you should and should not do, not lying down directly after, not working out that same day, and she'll discuss that with you. And then after any cosmetic injectable, we always want to see you back in the office 2 weeks following, so we can assess the area, assess the correction level, whether you are satisfied or if you'd like some more treatment. And then with the DermaSweep, again, something Daphne will explain, but generally when you call to make the appointment, and you can have a free consult with Daphne if you'd like to stop by and meet her first, and learn about some other specials and some other services we're offering, she will of course make those recommendations. And prior to receiving a DermaSweep and then just after, you shouldn't be using any retinol, no tretinoin products for at least 7 days. And then as well as staying out of the sun, and of course using sunscreen so that you don't have burned or suntanned skin when you have your treatment.
And guys, just so you know, that Ulta MD sunscreen that they were talking about earlier, it is super lightweight. You almost don't even feel it throughout the day. It doesn't affect, for my ladies out there, if you're putting makeup on, it really doesn't impede anything. And it's just, it makes you feel safe throughout the day. And remember, even if you are in an office all day long, sun rays, they come through those windows. So they are right, use the sunscreen. All right, guys, so I'm gonna go ahead and pull out one of these. I'm not in here, but I wish I was.
So I guess this first one can be for the DermaSweep treatment.
All right, DermaSweep treatment. We're sticking together. All right, I see Peter here, but I do not see him still live on. So we're gonna have to go ahead and take this out. Let's see. Oh my goodness, I'm hoping we don't go through these. All right. Andrea Trout. Nope, do not see her on as well. Oh, our viewers are getting excited over here. All right. Lisa, yes, Lisa is on here. She's named under her company. So she's from the Delray Beach Drug Task Force. So Lisa, how exciting for you. I have your email, so I'm actually going to connect you guys after the fact. That way everybody's still connected and that we can make sure you get your prize. All righty.
So this would be for the Dysport treatment with Dr. Chetiak.
Perfect, wonderful. And then, oh, a fan favorite, someone who was personally invited today, Karen Lawrence, has won the second prize of the day.
Woohoo, congrats, Karen.
All right, guys. Well, thank you so much for tuning in. I just want to double check. I see some things popping up here. All right, perfect. We had a couple of our winners say that they were here, but I don't see any more questions. So thank you so much, Dr. Chetiak. Thank you so much, Mara. I'm really excited to do some further research on the stuff that you guys talked about. And thank you for joining us. Please note, everybody, these are recorded. They are uploaded to Facebook, to the Chamber website, and to our YouTube channel. So we'll see you next week. Thank you again.
Thank you.
Thank you.